There's a small gland in your neck shaped like a butterfly, and it has more control over your daily life than almost any organ you own. It decides how warm you feel in a room everyone else thinks is perfectly comfortable. It decides how fast your hair grows, how thick your nails get, even what color your skin turns. And most people never realize this part. When the gland slows down, the first signs show up in places you look at every single day. Your eyebrows, your fingernails, the skin on your hands, the dry corner of your mouth. Your bathroom mirror is handing you data every morning, and almost nobody knows how to read it. Today you'll learn 15 visible signs of an underactive thyroid that you can spot on yourself, your partner, or anyone you love without a single blood test. If you want clear, honest health information explained in plain English, hit subscribe and leave a like. That's how this channel grows, and the goal is 300,000 subscribers. Checklists and short health posts go out on my Telegram channel, and there's a QR code on your screen right now if you want to grab them. Start with something you can do in the next 60 seconds. Walk into your bathroom. Take a glass of water with you. Your thyroid sits at the base of your neck just above your collarbones, wrapped around your windpipe. When you swallow, it rides up and down with the rest of your throat. So here's the test. Take a small sip of water, hold it in your mouth, tilt your head back just slightly, and swallow while you watch the bottom of your neck in the mirror. One quick word of caution. Don't confuse the thyroid with the thyroid cartilage, the lump in the middle of your neck that men often call the Adam's apple. The thyroid gland sits lower, just above the collarbones. If you can't see it clearly, that's actually a good sign. In a healthy person, it usually isn't visible. In someone with a very thin neck, it can show slightly even when it's working fine. But if you can see a clear bulge that moves when you swallow, the gland is most likely enlarged. That visible enlargement has a name, goiter, and it's worth bringing up with your doctor. To understand why a thyroid would grow that big in the first place, you need a quick picture of how your brain talks to it. There's a tiny gland tucked into the base of your brain called the pituitary. Think of it as the manager. It constantly checks how much thyroid hormone is floating around in your blood. If the level drops, the pituitary sends out a chemical message telling your thyroid to work harder. That message is a hormone called TSH, short for thyroid stimulating hormone. TSH pushes the thyroid to make more product and, over time, to physically grow. Here's where it gets interesting. If the thyroid itself is damaged, maybe by an autoimmune attack or a lack of iodine, it doesn't matter how loudly the pituitary yells. The hormone level stays low. So the pituitary yells louder. TSH goes higher. The thyroid keeps swelling. And in severe, untreated cases, the gland gets so large it starts pressing on the food pipe and the windpipe, making swallowing and even breathing harder. That's the worst case, but it's the exact loop that lets thyroid problems sneak up on people for years. Now look at the biggest, most visible organ on your body, your skin. Picture it as a brick wall. The dead, flat surface cells are the bricks. The natural oils and fats your body makes are the mortar that holds everything together and keeps the moisture in. When your thyroid is sluggish, oil production drops sharply. The mortar dries out. The bricks start to separate. Your skin loses water, turns rough, and eventually cracks in a pattern dermatologists describe as cobblestoned or tile-like. The medical name for it is osteotic eczema, or eczema craquelé, a French word that just means cracked. And this isn't a cosmetic issue. It's a sign that the deep machinery of skin renewal is breaking down. Your skin renews itself constantly. You shed dead skin cells every minute of every day, and over a year it adds up to a surprising amount. Research consistently shows we lose well over a pound of dead skin annually. That process is run by enzymes, basically tiny biological scissors that snip the proteins holding old skin cells in place so they can fall away. When thyroid hormone is low, those scissors get dull. The dead cells don't shed properly. Layers pile up. Sometimes the result is dramatic. There's a case in the dermatology literature that shows this well. A woman in her early 40s, let's call her Carol, came in with skin on her palms and soles that had thickened over 3 months. So thick it was changing the shape of her hands. The condition is called palmoplantar keratoderma. Keratoderma just means a thickening of skin caused by buildup of keratin. Keratin is the tough protein that gives your skin structure, the same protein that makes up most of your hair and nails. A little extra keratin is helpful, and that's how calluses form on the hands of someone who works with tools. But in Carol's case, the buildup was extreme. After about 9 months of thyroid hormone replacement, her skin went back to completely normal. The cause was fixed, so the symptom disappeared. Since we're on keratin, here's something worth knowing. Your nails are made almost entirely of it, somewhere around 90%. And your hair is even more, around 95%, which means anything that disrupts keratin production hits both at once. There's another well-documented pattern in clinical practice. A woman in her early 40s who lost almost all of her hair within 4 months. To understand how that's possible, you need a quick picture of how a hair actually lives. Each strand on your head is produced inside a tiny structure under your skin called a follicle. The follicle works for a while, then stops, and the hair enters a resting phase. After that phase, the hair falls out and a new one starts growing in its place. At any given moment, about 10% of your hair is resting. That's normal. That's why you see hairs in your shower drain every day. But when thyroid hormone drops, the whole cycle gets thrown off. First, hair production slows down and your hair gets thinner, duller, more brittle. Then, way too many follicles enter the resting phase at the same time. A couple of months later, those hairs all start falling out together. You can lose a huge amount in just a few weeks. In most people, it isn't quite that dramatic. It usually shows up as gradual thinning, especially along the part line or at the crown. But the mechanism is the same. And the encouraging part is that when the thyroid is treated, the follicles wake up and the hair grows back. In that documented case, 5 years after treatment started, the woman had thick hair and normal nails. Speaking of nails, they slow down too. They can turn unexpectedly thick, but also brittle, splitting, and peeling at the edges. Vertical ridges run up the nail from cuticle to tip. Quick honesty check. Vertical ridges can also just be a normal part of getting older, totally unrelated to your thyroid. So one ridge alone isn't a diagnosis. But when ridges show up alongside dry skin, hair thinning, and constant cold, it's a pattern worth paying attention to. Another nail change to know about is when the nail starts lifting away from the nail bed underneath. Air gets in and the nail looks chalky white or yellowish at the tip. The medical name is onycholysis. It can have many causes, including fungal infections, trauma, and nail polish reactions, but hypothyroidism is on the list. Hair loss with thyroid trouble isn't limited to your scalp. Your eyebrows, eyelashes, and body hair can all thin out. And here's one of the most specific things you can look for in the mirror. Look at your eyebrows. Specifically the outer third, the part closest to your temple. If that section has noticeably thinned or vanished while the inner part looks normal, that has a name. It's called Hertog's sign, sometimes the Queen Anne sign, named after Queen Anne of Denmark. Nobody knows for sure whether the Queen actually had hypothyroidism, but the term stuck. And it's a remarkably useful clue. Next time you're with your family at dinner, take a casual look. If grandma's outer brows have disappeared, her hair is thinning, and her hands are always cold, those 3 signs together are worth bringing up at her next appointment. Now the face, specifically swelling around the eyes, what doctors call periorbital edema. And here we need to separate 2 very different things. There's the ordinary puffiness you get after a bad night's sleep, or the look new parents have for about a year. That comes and goes. Then there's a different kind of swelling. Firm, dough-like, doesn't go away, and when you press it gently, it feels almost gelatinous. That's not water. That's something called Myxedema. The swelling comes from the buildup of a jelly-like substance in the skin called mucin. In normal amounts, mucin is part of the supportive scaffolding between your cells, a cushioning structural gel that includes hyaluronic acid. Yes, that hyaluronic acid. The same molecule cosmetic clinics inject as a filler. When your thyroid is healthy, your body makes the right amount of it. When your thyroid is sluggish, your body overproduces it, and it gets dumped into tissues, most visibly around the eyes, but also on the back of the hands and the feet. In severe, untreated cases, it builds up almost anywhere. There's a striking example from clinical practice. A man in his mid-30s, James, spent 2 years dealing with progressive weakness in his arms and legs before anyone figured out what was happening. When he was finally diagnosed with hypothyroidism, his doctors noticed something dramatic. His tongue was visibly enlarged and his calf muscles were swollen. swollen. Same cause, mucin building up in the tissues. With treatment, all of it reversed. And his case shows another important downstream problem with severe hypothyroidism: obstructive sleep apnea. When the tongue swells, it's more likely to fall back and block the airway during sleep. The person snores, briefly stops breathing, and wakes up feeling like they didn't sleep at all. And it isn't just daytime fatigue at stake. Chronic sleep apnea raises the risk of heart disease, stroke, and even dementia. Hypothyroidism is a relatively uncommon cause of sleep apnea, but it's one of the few that can be completely reversed by treating the underlying problem. That gel-like swelling doesn't just push on the tongue or the airway, it can also squeeze nerves. Here's a quick test you can do right now. It's called Phalen's test. Put the backs of your hands together so your wrists are bent at a sharp angle and your elbows point out to the sides. Hold that for about 30 to 60 seconds. What you're doing is putting pressure on a nerve called the median nerve as it runs through your wrist. If during that minute you start to feel numbness, tingling, or pain in your fingers, you might have a condition called carpal tunnel syndrome. The carpal tunnel itself is a narrow passage at your wrist where the median nerve and a bunch of tendons all squeeze through together. There isn't much room in there to begin with, so any extra swelling presses right on the nerve. The classic symptoms are tingling and numbness in your thumb, index finger, and middle finger, often worst at night when you're sleeping with your wrists bent. Research suggests a meaningful share of carpal tunnel cases, up to roughly 5% by some estimates, are linked to underlying hypothyroidism. That's actually a lot. And the good news is that when the thyroid problem is treated, the carpal tunnel symptoms often improve on their own. No surgery needed. So if you've been waking up with numb fingers, getting your thyroid checked is a reasonable conversation to have with your doctor. The median nerve isn't the only one that can get squeezed. Your facial nerve also runs through a narrow bony tunnel on its way to the muscles of your face. There's a rare but striking case in the literature. A man in his 40s, let's call him David, developed sudden one-sided weakness on the right side of his face. The corner of his mouth drooped. He couldn't fully close one eye. That looks exactly like a stroke. When the workup was done, doctors found the cause was actually mucin swelling pressing on the facial nerve inside its bony canal, a complication of his hypothyroidism. With treatment, the nerve recovered completely. That case is fascinating, but I need to be very clear about something. If you or anyone around you suddenly develops facial drooping, slurred speech, or weakness on one side of the body, treat it as a stroke. Call 911 immediately. Doctors will sort out the rare causes later in the hospital. With a stroke, time equals brain tissue. Moving on. You almost certainly know someone who's cold all the time. The person who pulls on a hoodie in July, brings a blanket to the movie theater, sleeps in socks. Maybe that person is you. Plenty of people are just naturally cold-blooded, but persistent, out-of-place coldness is one of the most classic signs of a slowed down metabolism. And a slowed metabolism very often traces back to a sluggish thyroid. Here's what's actually happening inside your body. Your cells normally burn fuel to produce both energy and heat. When thyroid hormone is low, your cells shift into a kind of energy-saving mode. They only do what's absolutely necessary to keep you alive. The extra warmth that comes from an active metabolism is gone. In extreme cases, this slowdown can lead to a life-threatening situation called Myxedema coma. This is a documented case from the emergency medicine literature. A woman in her mid-50s was brought to the emergency room with severe fatigue and confusion. The photos published in the case report told the story before any labs came back. Thinning hair, puffy face from myxedema, vanished outer eyebrows, the Queen Anne sign, thickened palms and soles, thick, brittle nails. But the danger was in what the photos couldn't show. Her heart rate was slow, her breathing was shallow. Her body temperature had dropped to about 93 degrees Fahrenheit. Her body was, in a very literal sense, shutting down. Myxedema coma is a true medical emergency, and even with the best treatment, mortality is high, historically estimated as high as 60%. The only way to survive it is fast diagnosis and immediate intravenous thyroid hormone. Even then, the hormone takes time to work, so these patients are managed in the intensive care unit. Fortunately, this woman survived, and 1 year after starting treatment, she looked like a different person. Here's a sign that's hard to miss once you know to look for it. A change in skin color. Some people with hypothyroidism develop a yellow-orange tint to their skin. It's most noticeable on the palms and the soles of the feet. The condition is called carotinemia. It happens because of a buildup of carotene, the orange pigment found in carrots, sweet potatoes, and pumpkin. Normally, your body converts most of the carotene you eat into vitamin A using a specific enzyme. When your thyroid slows down, that enzyme works less efficiently. Carotene builds up in your blood and gets deposited in your skin, especially where the skin is thickest, the palms and soles. Now, carotene buildup on its own is completely harmless. In fact, even with a perfectly normal thyroid, if you eat about 3 large carrots a day, your skin will develop the same orange tint within a few weeks. You'll see this trending occasionally on social media as a so-called natural way to get a warm-toned glow. But if you've noticed your palms looking orange and you haven't been doing any of that, your thyroid might be the reason. Now we're moving into territory you can't see in the mirror, but that hugely affects how you feel. Thyroid hormone has a direct influence on your brain. When levels drop, key brain chemicals like serotonin and dopamine, the messengers responsible for mood and motivation, also drop. Activity decreases in the parts of your brain that handle emotional regulation, memory, and focus. The result is something that looks and feels a lot like depression. Flat mood, foggy thinking, no motivation, the exhaustion of just being awake. And this is exactly why any thorough workup for new depression should include a TSH blood test. Treating depression without checking the thyroid first is like trying to fix a flickering light without checking whether the bulb is loose. If someone you love has had their mood drop for no clear reason and stay down for weeks, gently suggest they ask their doctor for a thyroid panel. For women, hypothyroidism often shows up in the menstrual cycle. Low thyroid hormone can push estrogen levels up and progesterone levels down. Both of those hormones directly affect the lining of the uterus. The result is often heavier, longer periods, an unpredictable cycle, and sometimes more painful cramps. Women with untreated hypothyroidism also often have a harder time getting pregnant. And during pregnancy, hidden or untreated low thyroid function is a significant risk to the developing baby. That's a big enough subject to deserve its own video. But if you're trying to conceive, getting your thyroid checked is one of the simplest, cheapest, most useful tests you can do. Here's an important reality check. We've been talking about the most visual, eye-catching signs of hypothyroidism. But the most common symptoms aren't the dramatic ones. They're the bland, easy to ignore ones. Constant tiredness, constipation, weight gain you can't explain. These symptoms are so generic that they're almost always blamed on stress, bad sleep, getting older, or just life. And that's exactly why hypothyroidism so often goes undiagnosed for years. The pattern in primary care looks like this. Someone bounces from a nutritionist for the weight, to a therapist for the fatigue, to a gastroenterologist for the constipation, when a simple TSH blood test would have given the answer in 24 hours. So what actually causes hypothyroidism in the first place? Historically, the biggest cause was iodine deficiency. Your thyroid literally cannot make its hormones without iodine, since it's a structural component of the hormone molecule. That's why back in the 1920s, developed countries started adding iodine to table salt. It was one of the most successful public health programs in history, and it largely eliminated the problem in places where iodized salt was used. But here's something interesting that's been happening lately. In some developed countries, iodine deficiency is quietly making a comeback. The reason is partly the popularity of specialty salts. Himalayan pink salt, fancy sea salt, kosher salt. Most of these are not iodized. If you've replaced your regular table salt with one of these, you've probably also cut your iodine intake without realizing it. That doesn't mean specialty salts are bad, it just means iodine has to come from somewhere, whether that's dairy, seafood, eggs, or a basic multivitamin. Worth a conversation with your doctor if you've gone fully off iodized salt. In countries where iodine intake is sufficient, the main cause of hypothyroidism is an autoimmune condition called Hashimoto's thyroiditis. In Hashimoto's, the body's own immune system slowly mistakes the thyroid gland for an intruder and starts attacking it. Over years, the gland gets damaged and slowly stops producing enough hormone. Hashimoto's is much more common in women than men. There are other causes too, like certain medications, previous treatment for thyroid problems, and inherited conditions, but those are topics for another video. Speaking of who's at risk, your odds of developing hypothyroidism go up with every decade of life. After the age of 50, the rates climb noticeably, especially in women, which means a lot of the things that get casually written off as normal aging, like thinning hair, dry skin, slower metabolism, and slow weight gain, might actually be a thyroid that's never been properly checked. So here's what I'd love to know. Tell me your age in the comments. I'm genuinely curious about who's watching because age shapes which health topics matter most to you and helps me decide what to make next. Now a quick rundown of how diagnosis and treatment actually work, because the good news is that this is one of the simplest stories in all of medicine. You get a blood test that measures TSH, that signal from your pituitary we talked about at the beginning. If TSH is high, that usually means your thyroid isn't keeping up with demand. To confirm, your doctor will often measure the thyroid hormones themselves, thyroxine, written as T4, and triiodothyronine, written as T3. Those three numbers together tell the full story. And here's the encouraging part. Hypothyroidism is one of the most treatable hormone problems in all of medicine. There's a medication called levothyroxine that is basically a lab-made copy of the T4 your thyroid is supposed to be making. You take it as a small pill once a day on an empty stomach. Your doctor adjusts the dose by checking your TSH every few weeks until it lands in the right range. When it does, your brain stops yelling at your thyroid and your body starts working the way it used to. So here's the bottom line. If you've noticed a handful of the things we talked about, like outer eyebrows fading away, skin that cracks no matter what you put on it, hair coming out in the shower, fingers that won't warm up in a warm room, doughy swelling around your eyes, heavier or wilder periods, fatigue you can't explain, or weight that won't budge, it's worth asking your doctor for a simple TSH blood test. It's inexpensive, it takes minutes, and it can explain an enormous amount about how you've been feeling. If the result comes back abnormal, hypothyroidism is genuinely one of the most rewarding diagnoses to treat. Modern thyroid hormone replacement has been used for decades. The dosing is well understood, and when it's right, people often describe feeling like themselves again for the first time in years. None of this is meant to replace a real visit with your own doctor. Take what's useful here, jot down your questions, and bring them to someone who knows your full health history before you make any decisions. If this helped you understand your own body a little better, hit subscribe and leave a like. It really does help this channel reach more people. 300,000 subscribers is the goal, and you're part of getting there. For the practical checklist version of everything we covered today, scan the QR code on your screen. That takes you to my Telegram channel where I post all the takeaway material.